Hey guys, welcome to lecture number 4 of the dairy management lecture series. So this is the first lecture that talks about real dairy cattle management. Obviously, the first one we have to start at calving and newborn calf management, right? So the first two slides are some questions just to recall what you learned during the first three lectures, right? So you might recall that we only produce about 40% of our local dairy requirement, and to import the remaining 60% we spend as much as 50 billion rupees. In 2018 it was 54 billion rupees, which was a lot. And then we can achieve self-sufficiency using either a low producing farming model, low producing cow model, or a high producing cow model. But we showed that high producing model has several advantages. I'm not quite sure if I emphasized this. I might have during the second lecture on agroecological zone. So basically we have, four types of dairy farming management systems in Sri Lanka. In the past, we only had these three, right? The extensive system, remember, with night paddocking, free-ranging cattle, the, highly intensive system, right? Like you see in Ambevela, New Zealand farm, Bopattalawa. It's a mixture of intensive and semi-intensive, one could argue. And then also this semi-intensive kind of management, which you see, small-scale farmers, small to medium-scale farmers. And then with the importation of cattle from New Zealand and Australia, we introduced another relatively new level of dairy farming. It's not as massive scale as these, because these typically have 500 cattle upwards, right? And these are like 20, 30 maximum cattle, starting from 2, 3, 4, 5 to 20 cattle. And then we started these modern dairy enterprises with 50 or 100 animals, right, with all the sophisticated farm infrastructure, right, which neither this nor that has. Sometimes this might even be more modern and sophisticated than this. So the way I see it, there are four dairy management systems in Sri Lanka right now. Okay. Okay, so with that, we conclude the introductory section and move on to newborn calf management. Right, so one thing I want to warn you about is, so because this being your first exposure to real dairy cattle management, we'll be starting practicals soon. So when we do start practical, you need to remember that animals are animals. Sometimes they look extremely innocent, right? Like in this example, they look extremely innocent. But if you, try to go and touch them, you need to be aware that things can get out of you can look at the dairy cow life cycle in another way. Remember, we talked about conception one, gestation one, parturition one, calving, and so on and so forth, lactation one, then conception two, gestation two, parturition two, lactation two, so on, right? So something you need to know is that when a calf is born, first initially it drinks milk, and then we use a term called weaning. Weaning is when you stop milk, right? So at what age do we stop feeding milk to calves? Right? Just find that out and do a simple Google search, and then at a certain age, calves undergo sexual maturity, which we call puberty, right? And then there is also an age for that, so it's not good to delay puberty too much, because if puberty gets delayed, then we cannot serve them, we cannot mate them soon. So lactation gets delayed. When lactation gets delayed, it's not profitable to the farmer. So ideally, we want animals to have sexual maturity at a relatively early age, but there's also a limit. They shouldn't become mature too early either. So find out the optimal values for these, right, before you come to the discussion. And then first service, first gestation, parturition, right? So there's a value for here also, right? So we say ideally you need to have the first calf by this age, month or year. So you need to find that out, right? And then so once that is done, you do the next service for next conception, second parturition, second lactation, and so on the cycle goes, right? So these would be what? From first parturition, that would be the lactation period, right? That would be parturition, lactation, and of course there's somewhere in between there's also a dry period, right? And so then it can go on. I think last lecture I asked people and you all said it might calve up to 10 times. Correct, right? Naturally it can calve up to 10 times. However, at a certain point the production level goes down, and in a commercial dairy farming enterprise it becomes non-profitable, right? So at a certain point, nth parturition, which might be as early as second parturition, second lactation, or as late as sixth or seventh lactation, the animal gets culled, right? Animal gets culled. So it depends on the type of practice you're at, right? So you can see two cycles. One is the animal is, lactating and dry period, non-lactating. Lactating, dry period, lactating, non-lactating cycle. And then there is also pregnant cycle. So pregnancy would be from, service, conception to parturition, conception to parturition, so on, right? So parturition, pregnant, non-pregnant cycles also you will see. Now, do you think when an animal is served, or this service is to be natural service, you put the bull, or you do artificial insemination? So do you think simply because you serve an animal, not you, but a bull or a AI technician conducts artificial insemination, do you think every service results in a pregnancy? No, not really. I mean, even among humans, you would have heard of, your older cousins, your friends, or your nandas and mamas, right, struggling to get pregnant, right? So, which is called infertility, right? So just because you perform a service, either natural or artificial, it doesn't always end up being pregnant, right? So that's why, we talked about the intercalving interval earlier, right? So the intercalving interval is not always 1 year. Ideally, it needs to be 1 year, but it's not 1 year because animals don't come to heat after parturition within within 3 months to get pregnant, or animal comes to heat, you do your service, but animal doesn't get pregnant, right? So these are the reasons why intercalving interval is not always 12 months. Even in well-managed farms in Sri Lanka, it's way above 12 months. Okay, so that is something to ponder about, right? And do some more learning about. Okay, so now we will move on to the carving pen, right? So you can have a carving pen, but there's no point in having a carving pen if you can't move the mother to the carving pen, at least a few days before carving takes place, right? So for that to happen, record keeping is extremely important. So if you have your proper records, okay, we did the artificial insemination on the January 1st, right? So the typical gestation period is, let's say, 10 months. By October 1st, this animal should calve. So middle of September, I'm going to move the animal to the calving pen, right? So that's why record keeping is extremely important. But unfortunately, most of our farmers don't keep records, right? So if you don't keep records, you don't know when the animal will calve. So you might have already built a calving pen, but you can't move the animal to the calving pen on time, right? So this is very important. Among the many hundreds of uses of record keeping, one is moving to a calving pen, right? So you keep them in isolation. You don't keep them mothers pending parturition, in the middle of all the busy cows, milking cows and so on, right? You don't. Right. So when you design a calving pen, right, if it's a large scale farm, you also need to consider where do you want to keep it. Do you want to keep it next to the milking parlor? Do you want to keep it next to the calf pen? So remember, calving pen and calf pen are two different things, right? A calf pen is where the newborn calves will be kept, right? So do you want to keep the calving pen next to the calf pen, or do you want to keep it next to the milking parlor, and so on, right? So some of the considerations you need to think of. Now you need to know, right, parturition process results in the expulsion of 50, 60 or even 100 liters of uterine fluid, right? A lot of fluid, allantoic fluid, amniotic fluid, which you might recall, right? So these are, of course, they are sterile when they come out, but once they come out, they are highly prone for, infectious organisms to grow, because, it's rich in nutrients, right? Good growth medium. So there will be all kinds of bacteria and stuff growing, right? So with such an environment, you don't want to keep this next to a milking parlor, right? For one, bacteria from here can go infect the adult animals, milking animals. And on the other hand, a newborn calf is relatively non-immune. You want to keep it protected from other animals, right? And all the disturbances, noises of cows shouting or even walking, makes a lot of noise. So you don't want the calving mother to be disturbed by those, or you don't want any adult germs to come here either, right? So you want this to be isolated, but at the same time you don't want it to be in the northeastern corner, which is 2 miles from the manager's office. You don't want it to be too isolated either. You want it to be freely accessible, right? Because sometimes we have to assist these calvings. And so farm workers have to be, on alert if there is an animal, if there's a cow pending parturition, because sometimes animal calves get stuck in the birth canal, and if you don't attend in a timely manner, the calf and or the mother can die and develop complications, right? So it needs to be an easily accessible location, right? So most modern farms, in the Western world, they monitor these calving pens using CCTV cameras, right? Or else it needs to be close to the manager's office or whatever, so that when he sees a cow in first phase of parturition, he could alert the farm workers, right? So it needs to be away from the calving calf pens as well as adult animal uh, barns. However, it should be within close vicinity for observation purposes, right? Either farm management or farm workers, right? So that is very important. And like I said, dry bedding is very important. You can't have mud here. You can't have soil, right? Because like I said, expulsion of the fetus accompanies expulsion of large volumes of fluid, right? And you don't want that fluid to make the place muddy and infectious, right? So it has to be, you have to keep well drained floors, right? And dry bedding, and of course a well ventilated area, so that the fluids get dried off quickly and you can easily clean it, right? So what do you think is the best type of bedding, right? So this is bedding, right? In poultry we call it litter, right? So similar thing. Now here, what do you see as bedding? You see straw, right? As straw, you can use sand, you can use wood shavings, right? So on, or rubber matting, right? So what do you think is best to achieve dryness and to achieve drainage and also to achieve comfort? Usually cows calve in recumbent position, lateral recumbence like this, but sometimes they can also calve standing up, right? And if they calve standing up and you don't want the mother to drop the calf on a concrete floor either, right? So usually you want some good padding. The best is sand, but straw is also acceptable as long as you provide thick bedding. So straw shouldn't be like 1 centimeter thick layer. It should be like more like 8 to 12 inches thick layer of straw like this, right? And then once it gets wet with uterine fluid, you can remove that part of straw and replace with fresh straw, right? It has to be isolated from adult housing, so on. So the ideal size for a calving pen is 12 feet by 12 feet, which comes to about 140 to 150 square feet. Right now, these calving pens can be either individual cows or for groups of cows. See, now this is sand. This looks like wood shaving actually. It's not sand. I was going to say sand. It looks like wood shaving, right? Not straw. And look at this. See, there are 4 cows altogether in this pen, and one of them had calved. See, massive udder, meaning they are about to calve. So these are sand bedded calving pen. I personally took this photograph. So there were 2 cows in this pen, right? So what I found really interesting was that when one cow calved, it might have been this cow that calved, the other cow that has not yet calved also came and helped to lick the calf dry. Now we'll be talking about that in a few more slides. And that's because, I mean, they lick their calves not because, somebody taught them that you should lick your calf, right? But because maternal instincts that come due to, you know, hormonal secretion, right? So I suppose this animal is also going to calve within the next couple of hours. So she also has all these maternal hormones secreted. So she also goes and licks the calf, something like that, right? So here's a video showing a mother licking a calf dry. Soon after parturition, I presume. You look at the thick layer of straw. It's not 1 inch, it's like 10 inches or 1 foot or even more in certain places. See, the mother licks the calf dry, right? So, especially in cold climate, it's helpful to warm the calf up. Otherwise, fluids can make it cold, give it cold shock. And on the other hand, when the mother licks the calf like this, it massages the chest so that it stimulates respiration. Right, so this is again a personal experience at the same farm in Australia. Right, so see the farm worker is assisting parturition. Right, so she didn't straight away go and pull the calf. So we usually say, once you see the second stage of parturition, right, when you see the head engaged in the birth canal and part of the fetus comes out, if it doesn't come out if there is no progression of parturition within a half an hour, the farm workers can go and intervene, right? So this is such an example. I think she should have pulled with both hands of the calf. Different story. She's not putting excessive, say, she didn't use excessive force. So why do you think she put her hand in? Did you see that? She put her hand in. See? There you go. She puts her hand in and takes it out. So why do you think she does that? She is doing that to make sure there is no twin. Sometimes you think, okay, the calf calves. Notice the calf. I think she's not yet breathing, huh? Not breathing yet. Okay, I think might have taken the first breath, right? Uh, she just want me to shut the camera off, right? So I switch the camera off, right? So there was no breathing initially. See, I think the placental membranes, the umbilicus is what you see here, still attached, right? Okay, so you should let's move on to the next slide. You should watch, if you haven't seen a calving, you should watch such videos on YouTube. There's another calving pen. So that's an adult cow barn, and part of it, so they have it adjacent to the, right? So they are also saying they observe with a video camera. Thick layer of straw. So in this video, you have all together the milking herd, the close-up group, that is close to parturition, and then the calving pen here, right? Sometimes you have no option but to do that, because if you have only one building, right, that's not ideal. You want the calving pen to be away from the milking herd and other animals for the reasons I explained earlier. But if you don't have those facilities, you have no option but to do this. I mean, 90% of Sri Lankan small scale and medium scale farmers, they don't have separate calving, area. They cannot isolate it too far from the other building, right? So you have no option if that is the case. But usually, you should try your best to locate it away from the rest of the building. So this shows a calving pen, the camera system in a farm, right? So there are different locations they are monitoring. Okay, so that's probably the calving pen, right? Holding area before milking parlor, the office. Some drugs are, you don't want them to get stolen. Bowsers that have come to collect the milk, right? So on. Break room. You don't want to see too many people in your break room. Ideally, you want it to be empty, right? Okay. So I hope you have done this during reproductive physiology, signs of parturition, the 3 stages of parturition, right? And if you have not seen calving with your own eyes in real life, I want you to go to YouTube. There are plenty of videos on YouTube that show. This is just one example, right? I'm not going to go through the whole thing. Bull calf being born, Jersey cow, right? Or something fell on the ground. She doesn't know what it is. Membranes. So do you think that's see limbs? We call anterior presentation, posterior presentation. So this anterior presentation, you see the 2 forelimbs as well as the little bit of the homber, right, rostral area of the face. Right. So see, I told you they eventually go down on lateral recumbency. Sometimes they might get up again, because think about it. They don't know what's happening. Nobody tells them. Just the hormonal changes that take place inside them, that guide them to, okay, do this, do that. Nobody has taught them, right? Just natural instincts. So that's why we have to be extremely patient and kind with animals. See? Other cows coming and checking out, hey, what the hell is this? Okay, so it's been carved and now it's being licked off, licked dry. So licking has 2 actions, like I said earlier. One is it stimulates respiration, and the other one is it, especially in cold climates, you want to dry it as soon as possible. Otherwise, it can go into cold shock. Right. We have another video here. See, the water bag has not ruptured. The water bag, allantois, not ruptured yet. Still not ruptured. Okay, the milk vein, that's a milk vein. Still covered with placental membranes. Huh? So if it doesn't break, we intervene, but usually it breaks, right? So if it doesn't break, we don't need to intervene. There you go. Mother licking the calf dry. Right. Okay. So once the calf is born, what do you think needs to be done? Right. So there is something called the golden hour. Right. So the first hour after the calf is born is called the golden hour because it's extremely important to attend to the calf as soon as possible, right? So you might need to resuscitate the calf, right? Now, in the 3 videos we saw, the mother did her job. She licked the calf dry, and this licking action stimulates the breathing, and the calf, uh, breathes just fine, right? And in one example, of course, the owner had to intervene and remove some of the membranes, right? But other than that, those membranes all got naturally removed, right? So this is very important. You need to keep an eye as soon as the calf is born. If it doesn't breathe, you will need to go and clean the calf with straw or a piece of cloth, remove the placental membrane, and then in the nasal passage and mouth, there's going to be mucus that was inside the amniotic cavity. Right, so remove those, clear the breathing passage, make sure the calf breathes, right? And then secondly, you need to remove the calf from the mother, right? Of course, under natural conditions, the calf will stay with the mother for months and months until the calf is weaned, right? Weaned off. But in modern commercial dairy industry, you take the calf, you separate the calf from the mother within the, like first hour. Some people see it as very inhumane thing to do, but of course there are reasons why they do that, because so one reason is, sometimes when the mother gets attached to the calf, it doesn't let the milk down, right? So that's the problem we see with Zebu breed of cattle. You can't milk the mother, right? So to milk the mother, you have to bring the calf, because only that the action of seeing the calf, the visual and the tactile stimulation is what stimulates the mother to let her milk down. That's difficult. That's bad practice in commercial dairy farming. So that's one of the reasons you take the calf away from the mother. And the other reason is, the mother can act as a source of infection, right? Like I said earlier, and I'll talk about that more in detail in future slides. The calf is not immune at the time of birth, right? So when it stays with the mother, mother's commensal organisms can act as infectious organisms to the calf. So those are the main reasons why they recommend separating the calf from the mother. And then another important thing is navel management practices, right? So I'll go into details about that within the next few slides. So I'm going to skip it here. And then of course, colostrum feeding. Now I asked this question, so you would have already answered. Why do you think what is colostrum? Is it different to milk? What's special about colostrum? What's special about colostrum? Can you recall? Right? So I hope you spend time on it, right? Spend time on it before you look at the notes, because that's important. Remember answering those questions. The idea is not to, get the answers right, but to get your brain stimulated, right? So why is colostrum important? What's special about colostrum? Okay, so some details about the newborn calf management. Resuscitation, like I said. So resuscitation, usually we have a word called CPR, cardiopulmonary resuscitation. When an dying animal collapses and stops breathing, you would have seen kiss of life can. So you blow into the mouth of a dying person, or somebody had arrested breathing. So that's called resuscitation. And also you massage the lungs and heart, chest, right? So resuscitation, if necessary, like I said, remove excess mucus from the nasal passage and mouth, wipe dry the calf's chest with a cloth or straw, remove placental membranes, uterine fluids. Usually the mother does this, and animal starts breathing spontaneously. If the mother doesn't do that, then that's when you have to intervene, right? So yes, you don't remove the calf before the mother licks the calf dry. You let the mother lick the calf dry, and then that's when you remove the calf from the mother, right? No, so we don't allow the calf to suckle the mother because the teeth are not all that hygienic for the calf. And then you move to hygienic calf housing. So this is not calving pen. This is calf housing. You remove the calf from the calving pen to calf unit or calf housing or calf barn, right? And then navel management, navel cord disinfection. Why? So why? What's inside the navel cord? What's inside the navel cord? Can you recall? There are certain what do you have? Bone, muscle, cartilage, continuous tissue. What do you have? Blood vessels, nerves, right? So there are blood vessels, right? Umbilical artery and vein, which connects the circulation systems of the calf and the mother, right? So if the navel cord gets infected, the infective material can get direct access to the calf's circulation and make the whole calf sick, right? So that's why it is important to do navel cord disinfection, right? So usually navel cord spontaneously breaks at the time of calving, right? If it doesn't break, you can break it off by either stretching or cutting. Don't leave it too long. If it's too long, it will touch the ground and get infected. You don't want to make it too short either, right? So traditionally there was a practice of tying the stump with a piece of nylon string, right? So the idea was when you tie it, no germs can go upstream into the body cavity. But then people found out that when you tie the stump, it can't drain off either. I mean, natural conditions, there's nobody to tie the navel stump, right? So nowadays they don't recommend tying off. They just leave as is, but if it's too long, they will cut it short, usually by stretching. What they recommend is using 7% tincture of iodine, right? Dipping, not spraying, dipping in tincture of iodine. We'll talk about how tincture of iodine is made on the next slide. And of course, colostrum feeding, right? So these were the 4 fundamentals of the golden rule. We'll go into a lot of detail on colostrum feeding shortly, right? And then, so this is where you need to do ear tagging for identification, because in a large farm, you have so many calvings. Now you are going to move it to the calf unit, and before you do that, you need to tag her. You need to identify the calf, saying, okay, this is the daughter of mother this, father that, right? So that you can keep records, you can track its progress. You can know, okay, this mother's calves have been highly productive and so on, right? So record keeping. And then if by any chance these calves are sick, newborn calves, You don't want to keep them together with the others. You have to separate them. You have to feed them last. Don't feed the sick calf first and feed the healthy calf second. That would be bad practice. You have to feed and or handle the sick calf right at the end. Right, so this is the navel cord disinfection that I told you about. This is actually not a calf. This is a sheep. So the fresh navel would be like this, wet and pink, and your goal is to make it dry like this all the way up to the body wall, right? And so the blood vessels, like I said, umbilical vein is there, umbilical arteries are there, so if infections can get in, they can go all the way up to the liver. And on the next slide, you'll see what happens when it goes to the right. So when the navel stump gets infected, we call it naval ill, right? And then infections can go upstream via the umbilical veins into the liver, and then it goes systemically, right? And then it can cause there can be abscession of the liver, and then they can join on synovial membranes or even the meninges of the brain, right? So when they settle in the joint, you get navel ill leads to joint ill, right? So this is where you need to use this tincture of iodine dip, to ensure that calves don't get it. So this is an example of a calf that has got joint ill. See the swollen joint? This is a case that was presented to the VTH just about a month ago, veterinary teaching hospital of the farm animal department, right? See, they swell and then they burst and the exudate comes out, and you need to clean them and treat them. But even if you treat them, there's almost like irreversible damage to the calf's growth. Right? So tincture of iodine. What is tincture of iodine and iodine? Tincture of iodine is when you mix iodine with ethanol, right? So you mix 10 ml of ethanol with 90 ml of iodine, you get 7% tincture of iodine, because that 10 ml had only 7 ml, because it's 70% ethanol. That 10 ml had 7 ml ethanol, so eventually you have what's called a 7% tincture of iodine, right? So in various literature, when you go through, people have used 2% to 5% to 7% tincture of iodine, but at the faculty we use 7% tincture of iodine. So we prefer dip over spray, right? Because when you dip, it can even go inside the navel, right? And if possible, repeat it. So do it immediately after birth, and then if possible, repeat in 24 hours, and so on. No harm to repeat it several times, right? So why do you think they put alcohol? Can't they put only iodine or alcohol only? The reason why both are used is because ethanol, it has a antibacterial effect, as well as it has a drying effect, right? So remember the picture that I showed you, the fresh navel was very pinkish and flush, whereas the dry navel was dark, dehydrated. So this has this drying or dehydrating effect, right? And iodine has a oil base, so it keeps it on the navel constantly, right? So in addition to the antimicrobial effect, that advantage is there, right? In the Sri Lankan market, you have these brand names called Betadine, Bocadine, anything works, right? But now, what do you think happens in the conventional farming system? Small scale extensive system, of course, none of this will be practiced. But sometimes small and medium scale farmers, they may not use this, but sometimes they use Kohomba margosa oil, which prevents, it's like a fly repellent, so flies won't come, but it doesn't have this dehydrating effect of ethanol, right? So ideally, you want this, right? So even if you see a farmer applying Kohomba ask them to switch to this, right? Sometimes as a veterinarian, you might have to, if you are the district veterinarian, you might have to prepare this yourself and go and give him, 50 ml of it, right? That's the kind of dedication you need to have. Right. So I asked you what the difference in colostrum was, right? I hope you have given it thought and come up with the correct answer. So basically, colostrum has two major differences compared to milk, right? One is colostrum has more total solids. When you say total solids, protein, carbohydrates, etc., everything is higher except one, which we'll talk about later. Total solids is higher, right? And the other difference is it has a lot more immunoglobulin, right? And why is that? Now, when we are born, do we have a certain level of immunity or not? For human babies, yes. See, so this is during gestation. Even so, this is about 5 months before being born, the immunoglobulin level gradually rise. See, fraction of serum immunoglobulin, right? So fraction of adult level, which is 100% is adult level, and by the time they are born, the birth, they have the adult level of serum immunoglobulin. Fraction of adult level of serum 100%, right? At the time of birth. For IgG, this is not IgM and other stuff, right? But in contrast, so this is called passive. I think you've already done this for immunology. Passive immunity. Then later on, what you develop after birth is active immunity, right? So and compare that to the situation in cattle. See, in cattle, these hours after birth, immunoglobulins, grams per liter or milligrams per ml, is 0. Here, it's 100% of the adult. Here it's 0. Why is that? Can you think why that might be? So whatever immunoglobulins it gets is after birth. Why is that? How did the baby, human baby, get this passively transferred maternal IgG? Preterm, before birth? No, it has to be through the placenta, right? So it has to be through the placenta, but in cattle, it looks like it doesn't go through the placenta, right? So why is that? Because there is an anatomical structural difference between the different placentation. So cattle have what's called a synepitheliochorial placentation. So if a molecule of immunoglobulin is to go from maternal blood to fetal blood, it has to cross 6 layers, right? The maternal endothelium, the connective tissue, uterine epithelium, fetal trophoblast cell, mesenchyme or connective tissue, endothelium again. 6 layers, right? Whereas so this is a dog and cat, endotheliocorial. Hemochorial is what humans have. In humans, see, this is broken and the fetal trophoblast is bathing in maternal blood, So it doesn't have to cross the endothelium, it doesn't have to cross the mesenchyme, it doesn't have to cross the uterine epithelium. It only has to cross 3 layers, 1, 2, 3, right? Or you can even call it if you want to call it a 4th layer, syncytial trophoblast, right? So 4 layers in contrast to 6 layers. And so that is why there is no immunity when the calf is born, right? So that is why colostrum feeding is extremely important, right? So now then you can say, okay, so how do you know if your colostrum feeding was successful, right? Okay, so let's say you have 5 calves, one of them drank 500 ml, the other one drank 250 ml, another one drank 2 liters, another one drank 4 liters. Do you think the immunity the calf is also passive immunity? The passive immunity the calf got from drinking colostrum was the same? No, it's different. The one that drank 4 liters versus 2 liters versus 500 ml versus 250 ml, right? So we can quantitatively measure the immunity transferred via colostrum or via the placenta or active immunity by measuring the immunoglobulins as a milligrams per ml quantitative measure, right? So now you must have heard of dengue antibodies, right? So there what we do is we don't necessarily quantify the antibodies. All we need to know is if somebody has IgM antibodies, you know, that says that he has been exposed to the dengue antigen, right? During short term. If he has IgG, dengue IgG, that means he has been exposed the long term, sometime back. Right? But here we can do a quantitative measurement of the immunoglobulin and find out if the animal has received sufficient immunity, right? So the accepted level of immunity is accepted and expected level of immunity is over 10 milligrams per ml, right? So when the calf drinks colostrum, the antibodies in the colostrum will get absorbed into the bloodstream, and in the blood it has to reach at least 10 milligrams per ml. If it's less than 10 milligrams per ml, then usually those calves are not very healthy. See, when they get less than 10 milligrams per ml, survival is only about 92% in 8 weeks, right? Whereas when they get 10 milligrams per ml, survival is 96%. So that means 4% mortality here, 8% mortality here. Now remember the word, the pronunciation of this word is mortality. Motility is the movement. Death is mortality. M-O-R, mortality. Right? Okay. So that's very important. Just because it drinks colostrum, that doesn't mean there was successful transfer of passive immunity, right? It has to drink in sufficient quantities. So when we talk about colostrum feeding, we don't advise a farmer. We don't just say, okay, you have to give colostrum, very bad practice. He doesn't know how much to give, how soon to give, and what vessel you need to, what route to give, and how often to give. Right? So when you talk about colostrum feeding, you have to elaborate these 4 areas. When you advise a farmer, you have to say how much, how many liters to give, how soon after birth you need to give it, how to give it using bottle or suckling the mother or bucket, and how often to give it, repeat in so many hours. So it's a big topic. So we are not going to spend time on it today, right? We'll go into details on the next time. And I also want you to think about, you know, the IgG concentration in colostrum. Now, for us to tell, okay, give them 3 liters or whatever, right? Can we do that as a universal principle? For each calf, Is it 3 liters, or will it depend on certain factors? For example, do you think the IgG concentration in colostrum is the same among all cows? A Jersey cow from Nuwara Eliya, a Frisian cow from Kandy, Sahiwal cow from Anuradhapura. Is it going to be the same, or will it be different? I have talked about the normal distribution or the Gaussian curve in the past. So just like anything else, in your class there will be few short people, few tall people, and the majority will be in the middle. Similarly, IgG concentration is also like that. In certain cows, IgG concentration will be very low. In certain cows, IgG concentration will be very high. But in the majority, it will be in the middle. So generally, we say the average IgG concentration is like 50 milligrams per ml. Right? So go through this and study this before next. Okay, so I was actually going to finish for today, but I thought I'd continue a couple more slides. So now then I want you to think, right? So like I said, if some animals have little antibody in their colostrum, some have a lot, and some, the majority has, 50 milligrams per ml. Is it correct to give the same quantity of colostrum to all calves, because the quality is so different, right? So how do you overcome that? This is kind of like this. I hope you don't have any experience of this. Right? We know the percentage of beer is what? Alcohol percentage of beer. Usually we say 4%. Strong beer, of course, has 8%. Wine has about 12%, and something like whiskey might have up to 40% or beyond, right? So 4% to 12% to 40%, right? To get the same amount of alcohol, if you drink 100 ml here, you will need to drink a liter here, because it's only 4% compared to 40%. So 1000 ml here, this is 3 times more concentrated at 12%. So you need to drink 333 ml or whatever, right? So similar principle here also, depending on the antibody concentration, immunoglobulin concentration, the amount of colostrum you have to feed the calf to achieve a given level of immunity, which we talked about 10 milligrams per ml in calf serum. That depends on the quality or the strength of colostrum of IgG, right? Just like alcohol, right? So ideally, you can't just look at the colostrum and say, okay, this has a lot of IgG, this has little IgG. So ideally, you need to use a colostrometer, right? So there is something called the lactometer. There's something called the colostrometer. I gave you a question asking you what the difference was, right? So the colostrometer does not directly measure the IgG concentration. It also looks at the specific gravity. But usually we can assume if the specific gravity is low, which is total solids, carbohydrates, protein, fat, everything. If the specific gravity is low, then usually IgG is also low, right? However, ideally, you should look at, you can, get analysis by the laboratory. You can look for immunoglobulin levels, or there are some indirect ways of measuring that also. Like you can look at GGT, gamma GT concentration, right? And so, you can look at the total protein also in a calf. If the total serum protein is 50 grams per liter, then you can assume, okay, then this animal has got sufficient levels of colostrum, right? And let's say if you have 100 calves, you don't measure this in all 100 calves, you take a sample, right? And of a sample, if more than 20% of 12 calves have less than 50 grams total protein, then you can say failure in passive transfer, right? Lead to problem in the farm indicates, right? So you can go through this slide, right, and understand what it says. So ideally, you need to know the calf size, right? So the volume. Let's say you give 4 liters to a 4 liters of the same colostrum, same mother's colostrum, 4 liters to a 20 kilogram calf and a 40 kilogram calf. Are they going to get the same amount of immunity or not, right? So we usually say the amount of immunity transferred depends on the calf's size, which ultimately comes to the calf's blood volume, which we say usually about 9% of the body weight, and then immunoglobulin concentration in colostrum. Did it have 15 milligrams per ml? Did it have 50 milligrams per ml, or did it have 100 milligrams per ml? And then you also need to know that every IgG molecule does not get absorbed in the gut, right? So if a calf consumes 100 molecules of immunoglobulin, approximately about 35% will get absorbed. The other ones will either just coat the mucosal surface of the intestine or get passed out with the feces, right? What gets absorbed is typically about 35%. Right, so using this data, do this calculation. By the time we come for the discussion, if immunoglobulin concentration in colostrum is 50 grams per liter and the calf weighs 40 kilograms, how much colostrum must you feed to achieve 10 milligrams per ml of immunoglobulin in calf serum? And so do this calculation, and we'll talk about it at the discussion. Right, and of course, it's not practical to do these calculations or measure colostrum strength. Not even Sri Lanka, nowhere in the world is it done, right? But then you just need to be able to identify high quality colostrum by looking at the thickness. If it's really watery, chances are total solids are low and immunoglobulins are also low. So we'll stop here for today, and we'll go into details about the 4 aspects of colostrum feeding next week. Okay, thank you very much, and I'll see you at the discussion.